Thank you again for joining us. On your screen, we appear as your SHIP TA team. So those are our pictures. You know who we are. I'd like to welcome our guest speaker, Rochelle Piznarski. Rochelle is based out of St. Paul, Minnesota, and has been doing health and health systems related research for over 20 years. She has a BA in International Business, Economics, and German from the University of St. Catherine in Minnesota, and an MPA from Rutgers University in New Jersey. Rochelle has conducted research and program evaluations for healthcare providers, nonprofits, counties, universities, networks, hospital associations, states, and national rural health research centers throughout the U.S. I'd like to thank Rochelle for joining us in part one of our three-part series, and I'm going to now turn it over to you.
Great. There's everybody. It's nice to see everybody. Hello, I'm in this screen. I'm the Rochelle on there. I recognize some of you, and hopefully some of you recognize me too. I kind of have that COVID look, so if you're feeling a little like you have the COVID look, well, I can relate. Let's see, I am going to share my screen here. Great, well, welcome. So this is the SHIP Evaluation Learning Collaborative Session 1. I'm going to just kind of give you some background and kind of get us started so that we can get to know one another. I always feel like when you are in a webinar series like this, it's really nice to get to know one another and just kind of get a feel for who we are. I don't know everybody in the collaborative group of participants. I'm thinking that everybody is noted on my screen. This is the list of folks that I got from Kiona. Is there anybody who's on today who's not listed?
Yes, you're missing 2 people from Missouri.
Okay. So who are the 2 people from Missouri?
Myself, Barbara Brendel. I'm the Rural Health Manager. I oversee the SHIP and the Flex Grant.
Okay.
And then Misty Dennis. She's our Rural Health Coordinator, helping to carry out the deliverables for the SHIP and the Flex Grant, as well as the State Office of Rural Health Grant.
Oh, okay, great. Kiana, do you have those folks noted, or would it be helpful if they wrote that in the chat box?
Sorry, I muted myself. I do have them noted. I can see everybody. Thank you.
Okay, great. All right, great. Well, welcome to everybody. So this is our group of participants. In addition, I'll add you guys for our next session. Sorry about that. We are going to do some introductions about ourselves. One of the things that I really like to do is I like to go around the table, kind of hear who's here. As you can note from this first slide, we have a variety of folks with different responsibilities. And so while this is the SHIP Learning Collaborative, we are going to be talking fairly generically about evaluation and then digging into SHIP more so during our second session. So we can really hit the needs of everybody who's sitting around the table. But I'd also like for everybody to kind of understand who is with us today. So we are going to spend a bit of time at the very beginning just to kind of introduce ourselves, make sure you kind of know who we all are. First, I'm going to just introduce me. You can see me here, but you can also see a picture of me, of what I look like some days when I'm having fun. I have been working in healthcare since about 1991, so for a long time. I was the Flex Program Coordinator in Minnesota from 1997 until 2002. So for those of you that are Flex Program Coordinators, I'm familiar with that role. It has evolved, I know, quite a bit over the years, but do have experience right in that role. Since then, I have been a contractor. And I've worked throughout the U.S., as Kiana mentioned, doing different evaluations for flex programs, for different grant programs, for federal state innovation model projects, etc. So I've been working in evaluation for a long time. Most recently, I spend a lot of my time on the flex program specifically. So that's kind of my area of, I'd say, greatest expertise. are the program activities, etc., that are in the Flex program. I know some of you sitting around the table really well. You know that already. So the pictures that you have in front of you right here on this slide, the top one is from Louisiana, the middle one is from Wyoming, and the bottom one is from California. Those are the 3 Flex programs where I spend basically all of my time these days. So when those folks introduce themselves, I know them quite well. In fact, I consider the Flex program staff from those states to actually be my friends as well. I also know a couple of states quite well for those sitting around the table. Wisconsin, I've worked quite a bit in Wisconsin, know the teams there quite well. Idaho, have worked quite a bit in Idaho. I believe we have somebody in participating from Tennessee. I have spent quite a bit of time working in all the critical access hospitals in Tennessee. And then also Iowa. This is the first year in 20 years I've not worked in Iowa. So I'm quite familiar with healthcare in Iowa and have had a great opportunity to work there as well. I think that's it about me. I really wanted you to kind of see who I am and get a little bit of a deeper sense of who I am. And do you have any questions about me in terms of kind of where I come from and what I'm doing? All right, great. Well, now what I'd like to do is hear a little bit about what I'd like to do. Oh, go ahead. All right, that might have just been a little bit of background noise. All right, so now we'd like for everybody to kind of talk about yourselves a little bit so we know who's sitting around the table. We're going to be spending several hours together over the next few weeks. I don't know if some of you are new to your state offices. I don't know exactly what your roles are. And I don't know if everybody sitting around the table has have a good idea in terms of who you are, etc. So I would like you to talk a little bit about yourselves. We can just go through the list here, starting from the top and kind of move our way down. A few things I'm curious about is, and that I think would work for everybody else, is the location, size of your office, etc., your role in your office, how long you've worked there, and then tell us a little bit about why you were interested in participating in the Learning Collaborative. Let's start with, I want to pronounce the name as Leela. Is it Leela or Layla Shepherd?
It's Leela.
Hi, Leela, you want to go first?
Hi, sure. Okay, I am the State Office of Rural Health Director, and our Office of Rural Health is located at the Florida Department of Health, so we're a state-centered program. Our Office of Rural Health consists of myself as the director, and we have a flex coordinator, Abby Parmenter, and then one part-time administrative person in our office. And we have the SHIP, Flex, and SOAR grants that we administer. And we also have a Flex Rural EMS supplement as well. And my role, I'm the director. So really, I have my fingers in all 3 of the grants, Flex, SOAR, and SHIP. And I've been working in the office just over a year. I started the end of March last year. So I'm not new to health, public health. I am new to rural health. I think I maybe can still say that with just a year under my belt. And I come from, prior to that, I spent about 12 years in public health preparedness, working with healthcare coalitions. And I was on a variety of public health emergencies, from hurricanes to tornadoes to H1N1, you name it. So that's healthcare coalitions, preparedness healthcare coalitions. That was my public health background. Why I'm interested? Well, I've been so busy with kind of getting the office kind of stabilized and to where we're spending most of our funding and kind of just really stabilizing the program would probably be the best way to explain it, to where I've not really spent a lot of time with SHIP. And so I'd like to hear how other states are managing their program. I think some states maybe have their hospital association manage the program or administer it. So that's why I'm participating.
Great. Thank you for sharing, and we're glad you're joining us.
Thank you.
Candy, do you want to go next?
Yes, hi, Rochelle. My name is Candy Smith. I actually work as the manager for both Flex and for SHIP in Louisiana. Our office is located within our Office of Public Health for our State Department of Health. We are a little bureau within that office, and our public name that we go by is Wellhead, Louisiana. We have a lot of other grant programs from CDC that are all wrapped into the same little division. I have worked in one way or another with both of these grants since 2008. Our SOAR is also in our little division. We've worked very closely together during that time as well. I think that probably one of the reasons that I'm participating is because, you know, we have been doing it a long time. It's been a lot of the same individuals. I've worked with Flex and SHIP. Our SOAR director has been the same the whole time. And I think maybe, you know, you get used to doing things a certain way, and it's really time to stretch beyond that and just see what you need to do to make your program even better. And so I think that's the reason.
Great. Well, thank you, Candy. It's nice to hear your voice. Hello, welcome.
Hey. Hey.
Let's go on to Rachel. Rachel, are you on? You might be on mute. Let me just scroll through the list here. Maybe not. Kiona, if I'm missing Rachel and she's on, we'll backtrack and just let me know in the chat. We're going to go to Sarah. And I know Barbara and Misty are both on. I don't know, is Rachel maybe not on? Let's look really quick. Misty, are you and Barbara together?
No, we're not together. But I see that Sarah is signed in, but I don't see that she's got a microphone to be able to speak.
Oh, okay. All right. Do you want to, do one of you guys want to just kind of give a little bit of overview about your kind of location, your office a little bit, and then you can talk a little bit about what your role is, and then we can switch between people real quick. And then for Sarah, if you want to just kind of put a little note in the chat box so people can familiarize themselves with you as well.
Barb, you want to go ahead?
Sorry, this is Kiona. I just want to point out too, Sarah is logged in using the audio, so she's not connected with her computer audio. She has her phone. So she's going to have to unmute herself. There, I unmuted her so she can speak.
Thank you. Can you hear me now?
Yeah, we can hear you.
Great, thank you. I appreciate that. Yes, like you were saying, Barb and Misty are on with us as well. So we're from the Department of Health and Senior Services, the Missouri Department of Health Senior Services, and I'm the chief for the Office of Rural Health and Primary Care. And our Office of Rural Health, really it's just three of us. It's me, and then Misty is our Rural Health Coordinator, and Barb is our Rural Health Manager, and we're responsible for the administration of the Flex, SOAR, and SHIP grants on the rural health side. And we also, within our office, have our primary care office, and those persons on that side are 4 staff on that side, which comprises of the primary care office grant, and also the student loan repayment grant. And then we also have 3 additional state student loan and loan repayment programs that are administered by that office as well. And, you know, we're joining because, you know, we're new. So I've been in my position since November. Misty's been in hers since January. And Barb since, what was it, Barb, just March? And we're all very new to our office. That we're not new to health. We all have a health background. So we're not new to health, but we are new to our programs. And we really appreciate being involved and able to participate because we want to learn as much as we can. We want to learn more. We want to collaborate more. We also want to learn more about, you know, best practices, also challenges, you know, what things have worked, what haven't worked, new ideas and innovative evidence-based practices. I mean, we're interested in everything. So we very much appreciate being involved. And Misty and Barb are on here as well. If you have anything to add to that.
Misty or Barb, do you want to just say one line so we can hear your voices so we know what you guys say?
As Sarah said, I am not new to health. I actually have 33 years now of experience with the Department of Health and Senior Services. So I have a very good background on public health. I was in the Office of Rural Health from 2008 till 2012 in Misty's role. And I left for a little over 7 years to work on the infrastructure for community health workers for the state of Missouri. But now I'm back doing rural health stuff. So.
Okay, and I'm Misty. Like Sarah said, I just started with the office in January. Previously, I've had, like, my health experience has actually been in the hospital and clinic, so this is kind of a different world for me, and I'm just excited to learn more about, you know, especially SHIP, but all of our grant programs.
Great. Well, welcome to all 3 of you. It's nice to have you here today. Let's go to Kyle.
Hi, my name is Kyle Cameron. I'm from Wyoming. Our office is located in the Wyoming Department of Health, Public Health Division, Health Resources and Emergency Response section. And then there we sit in the Rural and Frontier Health Unit, the Office of Rural Health. And similarly to a lot of you, the Office of Rural Health has the SOAR, the FLEX, and the SHIP. And then we also have the PCO, the Primary Care Office. We just got word today that the loan repayment through our state program has not been funded for the last, I don't know, 10 years, maybe 7 years. And we just got word today that the legislators are seriously looking at refunding our state loan repayment program. And that's such a huge win for us. So I am the FLEX, the SHIP, and now the C-SHIP program manager. We did have the EMS when it first came out, but we weren't chosen for the lengthy supplemental. We also have within the Office of Rural Health the Veterans FLEX funding. That's being held with or managed by the Office of Rural Health, and we just met our independent contractor who's going to help us meet some of those activities and those deliverables with the Veterans FLEX grant, and that's pretty exciting news for us too. I've been here in this position of both the FLEX and the SHIP for about 4 years now. One of the things for us here in Wyoming, and you guys may experience it as well, is we've had, I have 20 small rural hospitals, but in the past we've only dealt with about 18 of them. And in the past few years, that number has dwindled down because it's really, for the SHIP, it's really not a significant amount of money. And a lot of the hospitals feel like there's so much paperwork and so much documentation that it involves to receive, you know, less than $10,000 in grant money, that it's just not worth it. And so one of the things I did for the last 2 years, with the agreement of my project officer and with my my higher ups, was that we stopped taking out indirects. So I managed the SHIP program without any salary or any indirects taken out, because that's the only way I could get that dollar amount to be above $10,000 and get some of those other hospitals to buy in. All of our SHIP funds go directly to the hospitals, and yet one of the activities that the SHIP program asks for is some sort of cohort or networking. I have one hospital out of all of them that's an accountable care organization. The rest, as much as we present that, it's a no-go. Like, nobody wants to do the accountable care organization. So what can we do then to move towards value-based purchasing, bundled payment? And that's really the direction that I'd like to see us go. Because all of our hospitals receive their funds directly, we are now, as of today and as of last week, looking at what else can we do. And one of the things that we're going to kind of investigate and see if it would be a benefit is to have a rural health association in Wyoming. We don't have one. Even though we partner heavily with the National Rural Health Association, we don't have one in Wyoming. And so looking at the future and the future evaluation of the Wyoming SHIP program, that's one of the things we're going to look at in the next 6 months, is would it be of more value than for us to have a rural health association and do SHIP programs and SHIP activities within that cohort. We'll see what happens.
Welcome, Kyle. Thank you. Thank you for sharing. And as you can tell, everybody's learning a little bit more about one another's programs. There may be some opportunities for you to connect and network after this. So I encourage you to take notes in case that makes sense as well. Let's go on to Stephanie. Stephanie, you want to tell us a little bit about your office and yourself?
Yeah, can you hear me okay?
We can.
Okay, great. So I'm Stephanie Feig. I am the Flex and SHIP coordinator for Idaho. We're in the Bureau of Rural Health and Primary Care. That's in the Idaho Department of Health and Welfare in the Division of Public Health. We are a fairly small group. We sound a lot like most of you, right? We have the primary care office. We oversee the State Office of Rural Health grant. We have a state loan repayment program, and we have the Rural Physician Incentive Program. So those are kind of our two loan repayment programs, but I primarily focus on the critical access hospital stuff. So I have been here for 9-ish years, and I've always had the SHIP role, and we didn't actually have the capacity to have a full-time FTE in Flex until about 5 or 6 years ago. So when that came about, then I took that on with SHIP because it makes sense. And I am interested in this learning collaborative because I think anything that can help with evaluating is important. And SHIP in particular, I echo kind of what Kyle was saying with the same challenges of, you know, keeping folks interested in it. Although I think we've kind of got it down, you know, you kind of get your process in place and work your routine. And so I think that's always been a very helpful tool to use as like a kind of a little nugget when they want to pilot something using SHIP for that, and being able to be in the Flex role and the SHIP role really helps to try and recognize those opportunities. And so when I hear about a learning collaborative and evaluation and Rochelle Piznarski, I'm all in. That's pretty much my go. Whenever it's Rochelle, I'm there. So thanks for the opportunity.
So funny, Stephanie. Well, and I do have to put a plug for Idaho. The two pictures on the left are from Idaho. I don't know if you recognize those, Stephanie, but they are from Bonners Ferry.
Thank you.
Let's go on to Penny, Miss Penny Black.
Hello, everybody. My name is Penny Black. I work with the Wisconsin Office of Rural Health. We are university-based. I think that's the first one so far today, with the University of Wisconsin-Madison. And size, there are about 8 people, there are 8 people in our office. Plus, I usually can get like an MPH student or a GIS intern every other semester or so to help out, which is great for me. My title on the slide is Rural Health Epidemiologist. I am also the Data and Evaluation Program Manager for our office. So all things data related, program evaluation related, assessment related, if it involves data, my fingers are probably in it. So I've worked there now for almost 6 years, which is crazy to think of that. Before that, I was with the Population Health Institute at the University of Wisconsin-Madison, and they are the ones who put out the county health rankings, if you've ever heard of those. And previous to that, I was actually born and raised in a small rural town called Los Angeles in California. So rural health is totally my jam. I get it. I am still learning, and I've been here for almost 6 years. So I think it was Leila who said she was still new after a year. Yep, I'm still new, and it's been 6 years. So there you go. And why I'm interested in participating in the Learning Collaborative. I love learning. I love improvement, performance improvement, but also program improvement, and anything we can do to learn from each other and strengthen what we're doing is something that I'm interested in. So I'm excited to hear, I mean, much like everybody else has said, I'm excited to hear what other people are doing, what creative ideas come out of this, and how we can do some very practical things around evaluation to improve a program that, let's be honest, is not really set up for impact and long-term, evaluation. So that's, I'm excited to see what we can do, better.
Well,
I am complete. Look at me practicing the rule from the first slide. I am complete.
I'll need to practice that too. I haven't practiced that yet, but welcome, Miss Penny. I know Penny quite well, and I'm sure Penny will chime in a lot. She also contributed to the evaluation materials that were created as a part of Flex and Ship. So Penny is a great resource as well when it comes to evaluations. Let's go on to Carl.
Hi, I'm Carl Bryant. If you guys can bear with me, I'm participating from my phone from our emergency preparedness warehouse. We've been working on some COVID-19 testing kits, building those in-house and moving them out. So if I get knocked off, it's because the bandwidth out here is terrible. Anyway, I work in the Office of Primary Care and Rural Health within the Alabama Department of Public Health. Our office is currently 3 people. Our SOAR director, our director, who also managed the SOAR program, just recently retired. I don't know if any of you know him, but that was Chuck Lale. He had been in that role for a while. So many of you may know him, you may not. But my role in the office is I'm the Flex and Ship coordinator. And upon Chuck's retirement, I'm also stepping into the role as the SOAR director too. So I've been in the program since November. I've learned a lot, but I know there's mountains for me to learn, and I'm interested in taking that on, and that's why I'm here today to participate, to see what other programs are doing, how we can change how we do things for the better or build upon things that we're already doing. We manage our SHIP program and our Flex program in collaboration with our State Hospital Association. So yeah, that's it. I'm complete.
Great. Hey, and Carl, you said that you came on in November. Are you talking about November of 2019?
Yes.
Okay. Awesome. Well, welcome. Thank you.
Thank you.
Let's go to Cassie.
Hi, can you hear me okay?
We can.
Great. So my name is Cassie Kennedy. I'm the Flex and Ship coordinator in the state of Iowa. We are located within the Iowa Department of Public Health. Besides me, there's 2 other staff members in our office. And I've been here since April of 2019. So a little over a year. And I'm interested in this also just to kind of learn more, especially being new. Hold on, sorry. Sorry, I have construction going on, so it gets kind of loud in the background. So sorry if you can hear that. But yeah, I'm just interested in doing this just to learn more, especially because I'm new and I don't want to keep doing things just because it's the way that things have always been done.
Great. Well, welcome, Cassie. It's nice to have you here, and it's nice to have such a nice combination of new people, mid-range, and then some of our really seasoned folks. Let's go on to Renee.
Hi, can you hear me?
We can.
My name is Renee Clark. I'm at the Office of Rural Health. We're in rural health in North Carolina. It sounds like our office is ginormous compared to most people's. We have a good 40-ish, only because we house our team, then contracts, rural health clinics, data, placement, farm worker, HIT, and community health grants. So we have a very large, robust team, but North Carolina is extremely rural, so that could be why. I also want to just preface so everyone knows I have two little bitties, 2 and under. So if I have to like run away from a camera or you hear screaming, I'm just going to apologize right away. I'll do the best I can. I'm sure you see me like constantly listening because they're in nap right now. I've been here since November of 18, and I just want to give a shout out. I'm from Wisconsin originally, lived in Colorado, now here in North Carolina. So a little bit of all of that. I think I'm here mainly because I feel newish, only a year and a half in, trying to learn Flex, SHIP, and everything that our program does so that I can get just better practices and better ways of collaborating. Wyoming, I don't remember Wyoming's name, but like she mentioned, let me look real quick, that getting collaboration from the hospitals is difficult to do. So I want to talk to you all and see what you guys do. I'm complete.
Thank you. And I'm glad you could join us. And if those kiddos show up, it's A-okay. We've definitely seen that before on these webinars. Let's go to Andrea Porter. You may be on mute. Let's look.
I don't see her on our list today.
Okie dokie. And so let's go to Danette.
Hi, can you guys hear me?
We can. Welcome, Danette.
Okay, great. Well, I apologize if I cut out or anything happens here because I don't only work rural, I live rural. And so I'm in an area of Colorado that it's considered part of the metro area, but it's so rural. My dad would say even a jackrabbit has to pack lunch. So we're kind of in a unique situation out here with broadband. I work for Colorado Rural Health Center. This is my 10th year with them. I started in 2010 working on the REC program with meaningful use. And I am hospital and HIT programs manager. So I've been back and forth. I've had dual roles off and on, depending on what's going on with programs. And so I've been doing the SHIP program for 10 years, and I'm kind of a quality improvement, efficiency kind of a nut, and I like to improve things every year. And so if I can't improve something, then it bugs me until I can. So I'm here to learn more, understand more. Kudos to all of those who are fairly new to SHIP and Flex. Like I said, I've been here 10 years and I'm still learning and I still want to learn more. So our office has about 13 or 14 people. We have a program manager who manages the Flex grant, and she is the associate director for hospitals. She's my boss. And then we have a clinics team with an associate director who oversees all the clinics programs. And we have, with our outreach department, they do also recruitment for rural health workers. So there's quite a bit of stuff going on all the time. And this year we also are managing the survey and managing rural outreach for the census surveys. So a lot of things going on. Let's see, we are a nonprofit. So I enjoy that because it helps allow us to be more flexible and more nimble with what we do and how we do it. And I want to learn more about evaluation and overall management of the SHIP grant, because I want to help the hospitals get more out of their activities and their projects, because I don't want them to just be participating in the SHIP grant just to check off a box and get some money and okay, then move along. I really want them to have meaningful outcomes from their activities. So after I took this class in last fall, I implemented project plan documents for 2 bigger programs that we've got for MR workflow analysis and process mapping for accuracy, and also for charge master. And that turned out to be really great because we had a lot better engagement, because we had phone calls that went along with those documents and just dialoguing through them and getting to know more about what each hospital is doing with their project, helping them with some project management tips and suggestions, or asking them questions. And it really turned out fun getting that aspect done. And the one thing, Rochelle, that it helped me with was keeping everybody on track with measurable data. They tend to stray away from that. And boy, we really were able to keep a tight lid on that. And I think I might have upset a couple of people, because I went back and forth with them that, how to measure it, and then getting down to the nitty gritty of how many of this do you have when you started, how many of this do you have now, and helping them understand. And for those that kind of seemed a little perturbed, their CFO or other management jumped in and encouraged them. So that was really great to see. And so that project plan actually turns into their progress report by the time they get done finishing it. And it has an area for baseline data, and then end result data. So that is what I did this year to help improve those aspects, and hopefully getting through this class and learning more and getting stronger, more strength in the evaluation processes, we can do more and help them get more out of their activities.
Great. Well, Danette, just one thing. You were cutting in and out a little bit, so everybody wasn't able to hear everything you were saying. The other thing is we do have some feedback, which I think means likely that somebody has a phone on and the computer not on mute. So if you're using a phone, make sure that your computer is on mute. Otherwise, we're going to get feedback. The other thing too, Danette, just kind of to troubleshoot, given your Wi-Fi connection, you may decide to, I don't know what the connectivity is on your end from a listening standpoint and stuff, but it may be helpful for you to turn off the video portion of your connectivity. That does often help just because of the connection. But consider that. Are you by phone, Danette, or are you on your computer?
I'm on my computer. I have a microphone through the webcam.
We can hear you now a lot better. The video is taking up a lot. The video takes up a lot of bandwidth, so that we can hear you now a lot better when you're just on the voice versus using the video.
Is there anything you wanted me to repeat?
No, because as we kind of go through things, I don't know if everybody could tell, but Danette was on the last Evaluation Learning Collaborative. So Danette, as we kind of move through, it'll be great to have you kind of chime in and share some of what you've already started as we kind of move forward with the work that you're doing, so that other people can see kind of how you've implemented some of these pieces. It'll mainly come into play during the second session, but you'll definitely have different things that you'll be able to share because of the work that you've already been doing.
Thanks, Rochelle, and I'm looking forward to learning more and doing more with this, because it's made a difference, making the activities more interesting for me and for the hospitals. And I've gotten feedback that they like the phone calls with, the quarterly checkup with a phone call, not just with an email reminder. So going forward, we'll be having project management check-ins in addition to the paperwork they get.
Yeah, no, it's great. I'm glad. It's nice to get caught up on where everything is at, since it's been a while. Now, Kiana, I don't know if you can tell where the feedback might be coming from, but if Jesse, if that's something that you can look at on your end, where that feedback might be coming from, then we can at least troubleshoot it a little bit easier.
Sure, I'll just go ahead and mute everyone. So if you need to speak, you'll need to unmute yourself, and then we'll see.
Okay, great. Thank you. All right, well, awesome. Welcome to everybody. Hopefully that gives folks a good idea of where everybody's at. We clearly have a variety of people representing folks all across the country, which is super exciting. From a learning collaborative standpoint, our goals, they're pretty simple. I know that we have some folks that have lots of evaluation experience. That the benefit of that is we'll be able to maybe push the envelope a little bit further than we have in the past, just in terms of kind of where you're at and what you're wanting to work on. But my goals in terms of the learning collaborative is that everybody understands the purpose, components, and uses of performance management and evaluations. We're going to talk about that. That you learn the value of and how to create objectives and measures. That you learn how to collect, store, use data towards performance management and program evaluation. You may have your own goals as a part of this, but given the variety of everybody sitting around the table, those are the ones that we established before as we were planning and preparing for this. I need to hide my videos here. So just so you know, the learning collaborative components, I don't know how many learning collaboratives you guys have participated in, but this is a combination of 3 1.5-hour webinars. After doing this one time, really felt like we needed more time in order to dig into things. As I think all of you know, evaluation and program management in general it's complicated. So we will have 3 1.5-hour webinars. This first one, we're going to be just talking about doing an evaluation overview, talking about evaluation goals and priorities. Then our next webinar will focus on objectives and measures. After that webinar, I will schedule one-on-one technical assistance discussion calls with you. I use this as an opportunity to really kind of dig into your program a little bit more, put together some tools and resources with you, refine your objectives and measures a little bit more. And then during the last session, we'll be talking about collecting and using data, determining impact, and then the reporting piece. So there are different steps there. If we have a need for additional one-on-one connections, we'll make that happen as well. So it really kind of depends on what your needs are, what your availability is, since everybody's in kind of a different place. And then the other thing that we don't have on this Zoom that we did have last time, and if you haven't seen it, some of you are newer, so you may not know that it's available, but the center put together both Flex and SHIP evaluation toolkits. Those are out on the web. And in fact, Kiona, did you send those out to folks ahead of these webinars?
I have not sent them ahead, no.
Okay, so these slides will go out to you. There's a link here. This one's for the SHIP toolkit, and then there is also on the center's website, there's also one for the Flex program as well. But just so you know that most of what we're going to be talking about is going to be coming from that as really just kind of being a guide. Does anybody have any questions about the Learning Collaborative components and what we're going to be doing over the next few weeks?
This is Penny. I have a question.
Sure.
So one thing that occurred to me that I wish I'd included in my introduction, but I also wish I'd heard from others, and maybe we'll get into this more next week when we start digging into SHIP specific information. But I know different states execute their SHIP grants differently and have different numbers of hospitals. Like we have 64 hospitals that we distribute the funds for. About half of them do individual projects, half of them do a group project. So I would, maybe we'll be getting into this, but that might help provide some helpful context as to kind of get an idea of the scope and scale of our different SHIP programs, because evaluation, as you know, is going to look, and performance management is going to look very different depending on kind of what that composition is. So.
Yes, for sure. It will look very different. Good thought. We will definitely go around the table and hear what everybody, what just kind of the highlights of everybody's programs so that we can make sure that we know what some of the differences are.
Great, thank you.
Yep, perfect. Any other questions? All right, now as a reminder, make sure that I see something in the chat, make sure that you feel free to use the chat if that's the easiest way to communicate. I actually will sometimes have the video on and sometimes have the video off where I can actually see it. Part of that is so you can actually see the whole slide. Otherwise it gets covered by the video when I'm presenting. So if you are waving in the video and I don't respond, it's probably because my slide, my video screen is down. So just put a note in the chat box if I don't respond fairly quickly because I won't actually be seeing you. All right, so just a couple of ground rules as we get started. Some of these Keon already went through. I'm not actually going to go through them. You can just kind of browse them really quickly. The one thing to note is, as you can tell from everyone around the table, everybody's at a different place in terms of evaluation, just general knowledge of the programs. I mean, definitely, some of you know so much about FlexShip, State Office of Rural Health. And then others are newer, just kind of learning about their programs and what can be and what everybody else is doing. So keep that in mind. There is going to be some homework as a part of this learning collaborative. That is just going to be, your responsibility. It's not a huge amount of homework. So no fear should be there related to that, but just an opportunity for you to do some stuff offline, then bring it back, me to take a look at, and then we will talk about that homework and kind of what people have put together as a part of these learning collaboratives. All questions are welcome. I'll be asking questions too. I think Penny, you said that you like learning. I am always feeling like I'm learning. So I am sure that I'm going to learn a ton of stuff from all of you guys as well. And so just really see this as a learning collaborative for everybody. Today, we're just going to start by going over, doing some evaluation overview. We're going to tap into a little bit of purpose. What is it all about? Talk about some key questions, move into stakeholder involvement, then talk about setting priorities and goals. That will be the foundation for homework and also the starting of developing your evaluation plan. Today, we don't dig in as much to many of the details, and part of that is because I do like to spend a certain amount of time getting to know everybody around the table and where you're coming from and kind of what your background is, and also for everybody else to get to know you. That'll really help in terms of your sharing and even connecting after the fact once you start hearing more about what everybody's doing and what people are trying to accomplish as a part of your evaluation plans. All right, so getting started. We're just going to roll right into it, unless anybody has any questions before we move forward. Any questions? Let's see one in the chat box here quick. Oh, Soleil is out there. Hello from Soleil. We didn't do any introductions for anybody else who's sitting on here. Sorry, I know we have, I think Angie's on, I think a couple of other folks. Welcome to all of you guys as well. I'm glad you guys could join us today too. All right, so our first piece of our first item that we're going to talk about is performance management systems and just evaluation, and whether you have a performance management system in place, whether you have an evaluation in place. Now, my understanding with when I first got the information on everybody who was joining today, it looked like we had a combination of SHIP and Flex. So I wasn't sure if we were going to be spending all of our time talking about SHIP, but it sounds like we can really focus on SHIP, which is going to be to the benefit, I think, of everybody. So put your SHIP hats on. And if you just wear a Flex hat, that's fine too. But my question for you is whether you have a performance management system in place, and or whether you are evaluating your program. And then we're going to talk a little bit about the differences. So let's get started first by whether you have a performance management system in place, and whether you are evaluating, if you're currently evaluating your program. Let's just go around the table really quick if everybody can chime in. Is everybody evaluating your program in some capacity? You can open up your lines. Maybe Jesse, can you open up everybody's lines?
Yep.
All right. So do you want to just, let's just start with table. Leila, you want to start? Are you guys evaluating your program, doing any performance management?
Well, can you go to the slide where you had the difference?
No, we'll start first with whether you're doing it.
Well, I think we're doing more of a performance management system. Although I don't know if it's really a system. We're checking in with our hospitals on a quarterly basis where they are with using their SHIP investments. And we've also had quarterly conference calls. So, but in terms of evaluating, I don't know if the program has actually been evaluated in any real sense.
Are you, your funding is, are you using a cohort type of approach to your funding, or are you doing individual grants to individual hospitals?
These are individual, I guess you could call them grants. They're actually a cost reimbursement purchase order to each facility within the first 3 months of each SHIP year. At least that's what we did this year. And we don't take any indirect, we just give all of the funds directly to each facility. And when I came on board, it looked like those, whether they were through contracts or a purchase order, were sent out to hospitals, and there really wasn't very much communication with the facilities. And so that's one of the things we tried to do this year, was we tried to implement like an onboarding meeting as soon as those purchase requisitions were done, the purchase orders were done. At the end of August, we had like an onboarding call with all of our contacts at each of the facility to answer any questions about how they would use the purchase order and what they'd put on their application, and if they decided they needed to change something, maybe modify the application or how they were going to use the funds, what they would do. And then we added quarterly calls just as a way to start those discussions with the facilities, because what we found is, first of all, it is a small amount of money. And, they're super busy with everything else. I think $10,000 or thereabouts, really, they forget about it until the last couple months. And unfortunately this year, the last couple months has been COVID. So really I guess you could say we did evaluate a little bit the program when I first came on board, and we did modify our approach by doing the onboarding call, and we did have 2 quarterly calls. We haven't had one this last quarter, but I'm not sure if I'm answering your question.
Okay.
Well, I don't even. SHIP is really just it's been a neglected child this last year, compared to State Office of Rural Health and especially Flex.
Yeah, and that's okay. I think that, when we're talking about, the nice thing is to get a sense of, what you think you're doing, and then also a little bit of what it is exactly your program is, so that it can get shared with everybody else. So,
yeah,
Penny,
I had one other thing. I really am wondering if our office is really the most effective organization to be managing it, because it is with hospitals and the types of ways they can use the funding. Our hospital association does do a lot of trainings, and one of the things that we're considering is having I don't know if it'd be a contract with the hospital association where they would actually administer the grant. Maybe that's what you guys call a cohort, and maybe somebody could define what you mean by cohort.
well, I think when we're talking about cohort, it could even be groups of hospitals that are working together on a common initiative. In some states, I think it's all of the hospitals are working together on a common initiative. It could be groups that have chosen to work on some things. So it really does vary from state to state in terms of how they've kind of grouped their projects. But it would be the cohorts are typically hospitals that are trying to advance initiatives or address needs as a group of hospitals with common challenges and common needs.
Well, I know in Florida, from what I could see in the files previously from the previous director, and also this year, there are sometimes the hospitals, 3 or 4 will get together and hire a contractor to do a series of trainings. So we do have some of that, but it's done independently, or it seems to have been done independently of our office. So, or at least, so the hospitals themselves will communicate and do that together. So at least that's what I've seen.
Okay. So let's hear from a couple of other folks and what's going on in other states. Penny, do you want to talk about what you guys do in Wisconsin, and then whether you have any performance management or evaluation in place for your SHIP program?
Sure. So since the beginning of time, we've done the individual hospital grants, like Lila described. But if you've ever contracted with the university, and Rochelle, you have, the amount of paperwork and the amount of time it takes to process these, like Layla said, pretty small grants, we were losing interest from hospitals in even pursuing it, because it was so much effort and paperwork and annoyance and inconvenience and whatnot. Anyway, so a few years ago, we came up with this idea of creating a data dashboard that hospitals could use their SHIP funding, and we did that with our Wisconsin Hospital Association, where hospitals could use their SHIP funding to purchase access to this dashboard. And so depending on the number of hospitals that expressed interest, rather than us giving the money directly to the hospitals, we gave it to the Hospital Association. But the rest are still, and we're about half and half with our hospitals. Like I said, we've got 64 SHIP hospitals. So about half are participating in the group project or the dashboard, and about half are doing individual purchases for their own hospitals. So, and as far as evaluation, nope. We are definitely doing more tracking and process improvement. Since I came on board, we've been building up to that. But true evaluation, no. But honestly, I say that with no shame, because we've already made strides in even knowing at the end of the year what people actually spent their money on is a big improvement. So pretty happy with our improvements in tracking and making tweaks and trying to make the processes streamlined as possible for our hospitals. So.
Great, and yeah, no shame in terms of the performance management or evaluation. Let's hear from one more person. Let's go to Cassie in Iowa. You also have a lot of facilities that you're responsible for. So Cassie, do you want to talk about your what you're doing from how your SHIP program, what it kind of looks like, and then if you do any performance management, any evaluation work as a part of your SHIP program?
Yeah, so we contract with an organization, and they kind of push out the projects to the hospitals. So they will develop kind of pre-formatted projects within each of the categories. And as for evaluation, kind of like Penny, we do a lot of tracking, but not so much evaluation.
And Cassie, can I ask, who are you contracting with for your getting your projects out?
Hometown Health.
Oh, okay, and do all of your SHIP hospitals participate in those, or do you have some that are getting direct grants as well?
So Hometown Health will actually handle the direct awards too. So if they have a project that's not one of the pre-formatted ones, they can do that. So 67 do the consortium and 12 did the direct award.
Okay, great. Let's go to Missouri. Do you guys want to talk about yours too? Just give us some highlights in terms of how it's structured, and then if you're doing any performance management or evaluation for your program. That would be Sarah, Barbara, Misty.
I guess I'll speak since they're not. We currently contract with Missouri Hospital Association, and they then they individually contract with the all the 40. I think we have 43 participating SHIP hospitals for this year. We're off 46 next year, but we don't do any cohorts. It's all individual. And you know, still being new, I'm not aware that we have any performance management system in place. So it's still, you know, we definitely have some room to grow.
Okay. Just saving time, and we're going to eventually hear from everybody around the table in terms of kind of what you're doing. But just for the purpose of time, for those of you that didn't get to speak, if you want to just go and put a couple of notes in the chat box for everybody else to see, if you're using a cohort, if you're managing those grants one-on-one and pushing them out to your hospitals, and then also if you have performance management or evaluation in place, that just kind of gives everybody an idea of where we're at for now. Then as we kind of work through the collaborative, everybody will be familiar with kind of who's doing what and what are all the different approaches you're all using in order to fulfill your SHIP program requirements. So in terms of the difference between performance management and evaluation, there are differences. And I like to point that out, not because you have to be an expert in either performance management or in evaluation. But it just is a foundational piece. I think it's good just to know that there's a difference because people talk about it. I think the more we're implementing and managing programs, the more we're hearing about performance measurement and management and evaluation. Oftentimes they're used interchangeably. And they do have, I'm going to show you some, where they kind of cross over between one another, but there are some unique differences between them. Performance management is really quite a bit about data collection, reporting, and changing the program as needed. It's very objective oriented. So what goals and objectives have you established? Are you meeting those? Inputs, outputs, outcomes, all of that that you often see as a part of developing your applications, plans, etc. It's really an opportunity to make program adjustments based on what you're learning, and then also for you to really understand kind of who's doing what, are you achieving the desired outcomes, etc. For those when we're working on SHIP, you're going to be asking yourselves, are we improving, for example, satisfaction when it comes to your HCAP scores? Are the intended hospitals improving those HCAP scores? Are the intended hospitals engaged in the program activities, etc.? If we move forward to evaluation, evaluation tends to be a little bit more theoretical in nature. It's very results and goal focused. It moves past outcomes and into impact, and more specifically, were the outcomes a direct result of the program, and what was the ultimate impact? So there's a lot more kind of causality that's built into it. It shifts the discussion a little bit. As you can see, in terms of just looking at both descriptions, there's clearly some overlap, but there's also some definite subtle differences in terms of what you're trying to accomplish and what you would potentially be measuring when you're talking about either one or both. As I noted, there are times when both of these do kind of blend together and complement one another. They both include developing or improving measures of program performance, really help you to understand the relationship between activities and results. They both include generating data in order to analyze your programs, and then really looking at the quality of the data that's collected. They both require quality data and performance related data. So they do blend together. And that's why I think oftentimes when we are talking about evaluation, the discussion moves back and forth between the two. Now, while there is some commonality across both of these, we're not going to be digging in and sorting out the differences and trying to analyze, are we evaluating, are we doing performance measurement and management? We are going to be talking about both of these concepts throughout this entire learning collaborative. We're going to be moving between the two. I am guessing that for the vast majority of you, at least based on the last learning collaborative, the vast majority of you are going to be kind of more on the performance management side of things versus moving into the evaluation, more fully into evaluation. Also, the Federal Office of Rural Health Policy really has focuses a lot in terms of the data collection and then the reporting side, identifying those outcomes. So a good portion of what they're looking for does fall into some of the performance management stuff, but slowly as we get to be as our evaluations evolve, we move further. As our data collection evolves, we move forward into more of an evaluation realm. So you're going to be able to see this as we kind of go back and forth as we talk about evaluation, as we talk about performance management, but most of the time we're going to be blending both of them and we're not going to be separating them out. I just wanted to make sure that's clear to you so that we don't get confused because of terminology. I'm going to be using the term evaluation pretty much consistently versus using both of those terms. So, but when I say evaluation, I'm really meaning both of those. Does that make sense to everybody? And is this new, a new thing? I'm guessing some of you are aware, you know, of these two concepts and how they kind of blend across one another. For some of you, it may be new. You've seen both of them and you've kind of wondered, okay, what's the difference? Anybody want to chime in there a little bit?
This is Stephanie from Idaho. I don't necessarily think that it's new, but when you're thinking about it within this context, I think it's really great to make sure that we're all on the same page, because when you asked about SHIP, I automatically went, oh my goodness, let me think about that for a minute. So I think I struggle more on the evaluation side because I put a lot of energy into the monitoring piece of trying to make sure folks are spending their money and help them problem solve. And I can't remember who said that it was sort of at the 11th hour when they wake up and remember that they still have these funds. That tends to be sort of an annual occurrence, no matter how much I try to remind them. So I feel like my focus is to make sure that they're spending the money and spending it correctly. But I think where I lack, and part of the reason why I'm in this group, is that ability to sort of step back and take a bigger picture look at the program in general. And so I'm really grateful that you're providing these definitions, because it's also getting sort of my mind thinking about how to do this with SHIP, because I feel like I am in the weeds all the time and feel like I'm sort of always herding cats. So this is not necessarily new, but it's really very helpful and very important that you're taking time to walk through it.
Great, good. Thank you, Stephanie. So, and I do think that, you know, one of the things that I've seen is that, and I could be wrong, this is a whole new group of participants, but a lot of folks are tracking kind of the inputs and outputs. Most folks haven't moved to the outcomes piece of even performance management, and really using that data to make program adjustments, etc. And very few are using the data that's being collected to move on to the evaluation and you know, really analyzing the you know, one, do we have the data that we need in order to see if we're having the desired results, but also is there a kind of cause and effect in terms of the program and what the outcomes are. And so those are the pieces that we're going to work through as a part of this collaborative, really, you know, probably getting into the weeds a little bit more from a data collection standpoint, but then also taking that to the next step so that we can analyze what we're collecting as well. Anybody else who wants to chime in here? I see there's a few notes in the chat box. Everybody can take a look at those chat notes. And I think what we'll do with this chat too is we'll copy it and share it before we're done today, so that we can make sure that everybody can take a look at those after we're done talking today. All right, so we are going to move forward here. Before we move forward, we are actually going to just take a step back a little bit. And we're going to talk about kind of why we conduct and engage in program evaluations. What's the whole purpose, and why should we care? I think sometimes it's hard to make it a priority if we don't understand why, and we don't, and you know, it's not something that's really kind of important to us, because we're doing exactly what you said, Stephanie, which is just trying to kind of maintain things, make sure all of the T's are crossed and all the I's are dotted. But we are always doing evaluation, and we're doing any type of program management to understand and increase the impact of the program, improve the efficiency and effectiveness, validate the program and the activities intent. So, you know, have we done what we intended? To enhance program reporting, we're going to talk about that reporting piece. To support overall program development, management, and implementation, so the whole evolution of our program, why we're making program changes, and supporting its development. And then also to improve program engagement. I think the first time when we did this learning collaborative, one of the things that we heard that was a constant challenge for folks is that program engagement piece. And I believe that by using, that evaluation can really be a strength towards improving that program engagement. And I think, Danette, you even talked about that a little bit. We're going to hear from you related to that. But, you know, really tying in and making sure that we can be driving our evaluation and engaging our stakeholders in a way that makes them really want to participate in this initiative and understand why they're participating. We've talked a little bit already about why we want to evaluate our programs. But I'm going to throw this question out to a couple of you who haven't talked about why you want to evaluate your program. I'm going to throw it out to Carl. Carl, do you want to tell us why you want to evaluate your program?
So yeah, so currently, I've put this in the chat box, but when we get our reimbursement requests from our SHIP hospitals through the Hospital Association, we have a form that's a digital form that they can fill out how their funds were spent, and they're to provide us with an impact statement on, you know, what benefit, what the benefit was to their hospital by getting these funds. So when we get that information from one hospital, if we find out that there's another hospital that's been struggling with the same thing that could use that same training, we can use that as an example for the other hospital to build upon the same program to maybe help them out. But also it's just good to, I mean, the impact statements also just help us know how they're using their money and what it really means to them. All of our hospitals have really appreciated. It's not like it was said. It's not a lot of money, but it really does make a difference in our 32 hospitals.
Let's see. Let's go to one more person. Let's go to Candy. Why do you want to evaluate your program, Candy?
I'm really not sure how I want to do it. I can tell you that what we've sort of done is just mainly get the feedback, I guess, from our partnering agencies and the hospitals themselves is how we've done it in the past, which, you know, we can use SurveyMonkey, we can use things like that, but it, you know, it's still a kind of a limited way to get solid data. So, I mean, I feel like we're kind of at a place where we really need to think about how, you know, what our process should be going forward. I think what we've done in the past has just been that kind of thing, like satisfaction more so, I think.
Okay. So you want, it sounds like you want to move from kind of what you already know to kind of the next level?
Yes, that's correct.
Okay, great. Anybody else who wants to chime in about why you want to evaluate your program?
Rochelle, it's Kyle from Wyoming. And as I'm listening, I really think it's a good idea for us to evaluate the overall SHIP program. And then like individually at the state to really see, like we're supposed to be, like the 3 categories on the SHIP hospital application are accountable care organizations, value-based purchasing, and payment bundling. And so are we really moving towards a system that encourages value-based purchasing away from service cost for services? And I think for us here in Wyoming, it really is like we send this money out. It's the 11th hour right now. So right now I send out all my emails to my hospitals asking them to send me back their invoices. And I do ask for a statement or something to let me know, like, were these funds useful? And most of the time they say yes, but is this really the best use of our SHIP funds? Is this really moving us in the direction that we want to go to with healthcare reimbursement? And so I think that's why I want to evaluate it is, again, where are the gaps? Where are the challenges? Where are the barriers? What can we actually maybe be moving towards so that we really do change the way healthcare is financed, the way it's reimbursed?
Perfect, Kyle. Well, thank you. I'm glad you said that because you really kind of set us up for our next kind of points of discussion. That's exactly, those are exactly some of the questions that we want to be asking about our program and the things that we want to be thinking about in terms of actually developing an evaluation plan. Those are the questions that you're going to, if you want to jot those down, if anybody had some questions as I was asking that question, if you had any responses to that, you may want to jot those down right now, because those are going to be those questions are going to be the ones that are going to guide you in terms of actually developing your evaluation plan. So as we think about our evaluation and as we ask ourselves, why do we want to evaluate our program, we're going to go through a series of steps of kind of the who, what, when, and how of our whole evaluation. And there's a tool in the SHIP evaluation toolkit. Again, you'll get a link for that toolkit, but there is a tool in there to guide you through these questions so that you can ask yourself these questions and then create a response. But the who part is who will the key stakeholders be involved in the evaluation? Who's the audience for the findings? Are they the same people? What's the interest and question in your program evaluation? The whole who piece. Who needs to know that information? Kyle just asked some questions. Who needs to know it? Who's going to help you decide of all those questions, which ones are the most important? Which ones are going to identify your evaluation priorities? I'm a big advocate of taking the path of least resistance, making sure we have really good data versus a ton of data, and then also just making sure that we're engaging the right people in the discussion so that as you're developing your evaluation plan, it's going to be a plan that's going to engage people and it's actually going to respond to those questions that you want to know, that your SHIP hospitals want to know, and that your other partners there in the office and other stakeholders, if you're working with a hospital association, et cetera, that they want to know. So in addition to the who, there are the what questions that you're going to be walking through when you're thinking about your priorities. There's going to be the when questions. When are you going to need these, the findings from your evaluation? Because that's going to help guide kind of what you can do, what's going to make most sense. It might be something that takes place over a couple of years. It may take place over a quarter. It all just kind of depends on what you're trying to go after, and then how you're actually going to conduct that in terms of the data that's collected, the stakeholders that are going to be involved, all of those internal and external findings that you identify. How's it going to get shared, and how that's going to evolve. So as a part of this whole evaluation process, there's going to be all these different questions that you're going to want to be able to answer as you put together your evaluation plan, including that big question of why you want to evaluate your program overall. So one of the things that I mentioned just a couple of seconds ago was the stakeholder piece, and we're going to end it today with the stakeholders. I know that we're pushing the time here, but something that I believe that a lot of our programs don't do when you're developing an evaluation plan is engage stakeholders. So I highly encourage you to be thinking about your stakeholders and to engage your stakeholders as you're developing your plan. You're not going to be able to do this as a part of our collaborative here, but as you put together your plan and as you formulate it, I encourage you to take it back to your team. I encourage you to take it back to your SHIP hospitals and to really think about, is this the questions that you want to ask as a part of your evaluation, is it going to meet your stakeholders' needs? Because as we move forward, you're going to see that having that stakeholder involvement is also going to engage them, not only on the evaluation side, but it's going to engage them in the program participation side, because all of these pieces are going to fit together. So stakeholder engagement is going to be really important as you put together your evaluation plans. I've got a couple of slides here in terms of who to include and why to include stakeholders as a part of this process. But when you get these slides, I encourage you just to take a look at them so that you, and to think about it. And we're gonna revisit this stakeholder engagement piece a little bit on our next discussion, just so that you can see, just so that we can make sure that everybody understands kind of the value of stakeholder engagement and including stakeholders as a part of that process. So I'm going to go over some of the highlights as a part of our next learning collaborative. The other thing I want to note is I do have a couple of resources in here. I highly encourage you to listen to the 5-minute and 21-second video so that you can get some additional information on stakeholder involvement. It's a great video. It's super short and it can just kind of give you some tidbits related to that. Now, for our next learning collaborative, what I would like everybody to do is I want you to think about, we heard a little bit about programs and kind of what people are doing. Some of you talked a little bit about your programs, but what I'd like you to do is just to identify a specific goal or focus for priority for your evaluation. Are you looking to, do you have a specific goal as Kyle had indicated? Are you trying to figure out who you've impacted and how you've impacted? Are you looking at the potential for replicating or changing your program? Think about what your evaluation priority or priorities would be. If you've got priorities, make sure they're tight and that they're not big and lofty, and identify those. And if you can email those to me, I will work with those and we'll incorporate those into our next discussion. So think about what your priorities are for the evaluation and what you're trying to get out of your evaluation for it. So what do you want to learn? What decisions do you want to make? That is the question that you're going to be identifying, and you can email that to me so that we can talk about those as a part of the next learning collaborative next week, and then start to use those in order to develop some measures and to develop some objectives so that we can identify those.
Rochelle, real quickly, I'm guessing Kiona is going to follow up afterwards with a reiteration of what our homework is so that we all didn't have to take a screenshot of the slide that's in front of us.
That's correct. The slide deck, the recording, and then also the resources for the SHIP program evaluation webinar and guide will be shared in an email, so you'll get those soon.
Okay, great, and thank you. And Rochelle, the other thing is, what keeps running through my mind, and I know we're short on time, is the reality of the SHIP program is that it is not a multi-year, multi-million-dollar strategic initiative. It is by and large individual hospitals purchasing things like software and other individual purchases. And so I love the idea of evaluating if we're moving towards value-based purchasing, but the SHIP program is not necessarily set up that way. So I feel like we need to temper our expectations with the reality of the SHIP program.
Yeah, but that's what the application has, and that's what the SHIP program is about, is those value-based purchasing. ACO, when the hospitals fill out their application, that's at the top, is what activities are you going to do to support either an ACO, value-based purchasing, or bundle payment. So even if you're doing HCAPS is there in support of an ACO or in support of value-based purchasing.
Then I'd like to change my collaborative and say I'd like to learn how to evaluate progress toward those goals based on the SHIP project.
Yeah, so and Penny, I think that your point is really a good one, because you know, you can break your question down further than you know, are you working towards an ACO, or you know, have you advanced towards an ACO? So think about what your program goals are. Everybody's in a different place. And that can ultimately be what you're aiming towards, but it doesn't have to be your end game at this point. So I highly recommend that you know, if you haven't been working there already, that you start a little bit further back in the process. Think about the way that your program is currently structured, and come up with a few questions. What questions would you like to ask? What do you think? What questions would be of value to your stakeholders, the hospitals that you're working with? Start there, and then we will move from that point forward in order to start developing your evaluation plan. Does that make sense to everybody? One thing I'm going to note, just because I wrapped up pretty quickly here, I always find that, you know, the time goes by so dang fast, but I do like to spend a lot of time on introductions so people get to know one another, is that you can reach out to me, send me an email. I've been working on tools and evaluating SHIP programs across a number of programs now. So if you have questions, if you have ideas, throw those out to me. Throughout the duration of this learning collaborative, I'm an open resource to you. So obviously with limitations, but you know, just send me your questions, and you know, we can work together to formulate your ideas and start to put some pieces together. This is just the first step in your process of putting together an evaluation plan. As I noted, we're going to focus a lot on measures and objectives, pretty much measures and objectives during the next discussion. But for right now, if you just want to put together those questions, the things that you want to answer about your program, whether you're administering multiple grants across your facilities, or if you've got cohorts in place, it might be for one cohort, it might be for multiple cohorts, send those questions to me, and then we can start building your evaluation plan from there. Any other questions that you guys might have? And yeah, for the Missouri, anybody that's joining in as a group, if you want to do it together as a group of participants, so Missouri, for example, you have 3 people, do it together as a team. When we do the one-on-ones, we'll be meeting as a team, not as individuals. Anybody else?
Thank you.
All right, well, thank you everybody for joining today. I look forward to getting your priorities back from you this week. Otherwise, you guys have a great rest of the week, and everybody stay healthy and everybody stay safe.
Thanks, you too.
Thank you. Bye, everybody.